Hello, this is Dr. Anna Chesnakova. In this video, I wanted to discuss with you how SIBO is diagnosed. So, gold standard of diagnosing SIBO is aspiration. So, doctors can perform this endoscopic procedure where the patient swallows endoscope and they absorb the content of the small bowel, aspirate it, and then they can count how many bacteria they found and also culture this bacteria to see what is growing. But this procedure is invasive and this is very expensive, and see, in our country doctors are not aware generally of this condition, or it is very difficult to get referred to have it diagnosed. Therefore, we as nutritional therapists and naturopaths are using other methods of identifying SIBO. First one is a breath test, which is simpler and cheaper. How it is done, client gets special solution which they drink on empty stomach, and before that they take a breath sample into special collection bag, and after they drank this solution there are certain intervals when they have to produce another breath samples. Then these samples are sent to laboratory, and laboratory analyzes the gases in the samples, and it is based on the understanding that bacteria ferment those carbohydrates in our intestines and produce gas. And usually laboratories analyzes hydrogen and methane concentration and give two types of solution. One is producing bacteria is utilized in producing hydrogen, and another one is utilized and produced methane. And then laboratory, after analyzing the concentration of those gases, make a graph, and they calculate how much the concentration is increased, and they then use special criteria, and then they can say whether person has SIBO or doesn't have SIBO. The problem with this test is that it only analyzes two gases, whereas we know that bacteria can also produce third type of gas, which is hydrogen sulfate. So this is limitation of this test. Therefore, I very much like the other test, which is not specific for the SIBO, but it has lots of information which helps us to address predisposing factors which can lead to SIBO, and also it has many indicators of SIBO. And I would like to share you two examples of my clients whom we had this test done. Obviously, after this test we can do breath test if necessary, but if money is an issue, then this test called GI effects can be sufficient on top of the client symptoms. So this test is analyzing DNA of the bacteria in stool, and then it can produce such graphs. So for example, this client graph is higher than the graph which represents healthy cohort, which means that this client has much more bacterial DNA in their stool. Although this does not point out exactly where this bacteria is, but together with the other indicators such as high fat in the stool or high concentrations of short-chain fatty acid, together these three can indicate that this person might have SIBO. And as I said, that if client is experiencing typical symptoms for SIBO, then it can be sufficient for us to treat it as a SIBO or to address the symptoms. This client had PCR counted the DNA of the bacteria in the stool of this client, and it was found that she has two types of bacteria. One bacteria is called desulfovibrio piger, which produces hydrogen sulfide, very toxic gas, and the other one, methanobacterial smithy, which produces methane. And all of this, the amount of bacteria came in red for this client, which means that the amount of DNA of this bacteria is much more than expected normally. So, and again, she had higher amount of overall bacteria in her gut, which is like higher. This graph, which represents the amount of bacteria, is higher in comparison with a healthy cohort. And together with the symptoms of this client, such as like very severe bloating, stomachache, cramps, we made the decision to address it as a SIBO, and not to have this breath test done. So this is how we identify SIBO in nutritional therapy and naturopathy practice.